there is a system which I wish to put in place, which I have asked the GHA to look into introducing, which is called Martha's Law, which I'm sure the Honourable Lady opposite is aware of what Martha's Law is. Martha's Law is a law in the UK which was brought in when a young girl, Martha, was taken to hospital with sepsis. Martha's parents then lobbied the UK government to ensure that there was an outreach programme from the CCU to the other wards in the hospital, Madam Speaker, so that if you are sitting at the side of a bed and there is a patient that is acutely ill, you are able to call on a second opinion, as it were, so that a CCU doctor can come and evaluate the patient, be it a child or be it an adult, in order to ensure that they are not missing one of the vital signs of sepsis. Madam Speaker, one of the things that I have asked Mrs. Murphy to do also is, or one of the things that I have asked the hospital as a matter of policy to look into, is whether we can introduce Martha's Law at no additional cost to the hospital. Madam Speaker, as somebody that has seen a child deteriorate in hospital, it is something that is extremely important to me to be able to have anyone who is by a patient's bed to require or to request a second opinion, and for a CCU doctor or nurse to be able to reach out and see whether the staff, doctors and nurses are missing a vital sign of sepsis. Therefore, Madam Speaker, what we have requested, what has been requested of Mrs. Murphy, is to try and identify, one, if there is any area where there is indeed overstaffing in any of the wards in the hospital, and if any of the nurses can therefore be used as a critical outreach nurse to go to all the different wards. So, Madam Speaker, I would argue from a personal as well as a political perspective that the work that Mrs. Murphy is doing in order to ensure that the different strands of this policy are implemented would be extremely important.